Hi, I'm Dr. Ali Kareen of Kareen Pediatrics. We're here for a COVID update, and I know we do them less frequently lately, but there's not as much news as there used to be. So today we're going to talk about some things in the news around COVID, and so try to answer some of those questions for you. And then also about how to navigate the back to school rules, which I think we're going to need some help for you guys in knowing how to navigate those to keep your kids in school as much as you can as more children go back to the buildings. One of the big questions I've been getting is what's going on with the numbers, what's going on with the cases and the deaths, and for the most part we are seeing what we would expect, which is in areas that were very tightly locked down early and didn't have a lot of cases or deaths. They're going to have some rise as they open up because they haven't had any exposure yet. So those aren't really second waves, those are really first waves for those areas of the country or states that never had a wave in the beginning. We also are seeing some bumps in what we would say cases and even some death bumps that have gone up nowhere near our original numbers, even in Ohio or in other states, but we are seeing some increases and then they're starting to come back down, and I would expect that to continue. The big thing that you need to not stress out too much, even though it's talked about so much, is how many cases we have, because we are testing asymptomatic or mildly symptomatic people, and so you'll see that those case numbers go up, but the fatality rates are still pretty low. And in all of our states, if you look at our hospital resource data, all of our states have been doing great since the original surge that was in the upper mid-Atlantic, New York, New Jersey, Massachusetts area. Since then, we have not had any hospitals that were overrun. Everything has been great, which is such a testament to our great medical system and all the things that we've done. One of the most exciting news is that we are actually learning how to treat COVID better. So you keep hearing these terms about what is our fatality rate with COVID. There are two numbers that are thrown around. One of them is a case fatality rate and one is an infection fatality rate. Case fatality rates is you're sick enough to go to the hospital, get admitted, have symptoms. And so there's been a little bit of disagreement on what considers a case. But basically, if you get admitted, what is the chance that you are going to live through that hospital admission? Infection fatality rates can include patients who never had symptoms enough to be diagnosed. And those numbers, of course, are greatly different in as far as fatality rates go. But let's just focus on the patients that are sick enough to go to the hospital. They are doing better. So our actual case fatality rate as associated with admissions is getting better, which is great news. We have new medicines, new technology, new vent settings. Frankly, our doctors are really smart. They learn quick. They talk to each other. I'm on forums myself where they discuss all the new things they're learning, and we've learned a lot. So the good news is even when admitted, patients are doing better. That infection fatality rate represents what are the chances that we are going to pass away if we get exposed to COVID. And that number has dropped quite a bit as new data comes out. And you can see in a video that I just posted yesterday that there was some detailed discussions about that. And we're thinking population-wide across the entire world. They've done it in multiple different areas. It's about 0.2 to 0.3% infection fatality rate. And of course, that's higher, much, much higher in our high-risk population and lower in our pediatric population. So again, like we knew back in March, children are handling this disease very well. I also want to talk to you about vaccines. So, in general, I would actually agree that we don't necessarily want to speed along the development of something we're going to give to everyone. So I have been myself a little bit hesitant hearing about Project Warp Speed. How do we get vaccines approved quicker? So I've looked really deeply into that, and there is a video in our feed with ZDogg and Dr. Offit, who discusses what the structure of Project Warp Speed is. And what they've done to speed up the production is remove all of the obstacles that are basically there because of money. So one might argue we have spent an awful lot of our taxpayer money to make this go forward. But we basically threw so much money at the process that we have speeded up through all the obstacles that normally come while you're waiting to move to the next phase and procure the money for the next phase. So that's why we're going along so fast. We actually have vials of vaccines sitting in warehouses right now, being produced and stockpiled, waiting for the data to come in for that 15 to 30,000 initial participants in the study to show that it's safe and effective. And once those numbers come in, they actually already have the vials ready for distribution. If they find that they have trouble with the vaccine, then those vials will get wasted. So again, we talk about maybe we've wasted some money, but at least we are still maintaining the safety. So I don't want anybody to be confused about that. When we talk about efficacy and safety, of course, these will be short-term studies, so there's only so much we can know. And of course, it's easier to measure efficacy if the person is exposed, and we are getting less and less exposure. So there's going to be a little bit of work for the researchers to do to prove that. So a lot of variables going in there, but we'll see some end to this vaccine process sometime, probably by the end of the year. And if you are a person who would like a vaccine, I do not have any concerns that the speed at which they have done this research makes it really any different than any other vaccine that is brought to market, because they are using the same criteria for its approval as they normally do for vaccines. So hopefully that helps answer some of those questions. We have back to school time going on, and I've participated and helped with some of the school back to school planning for this, and so I've read all the documents from Franklin County Board of Health, and they're pretty narrow, and schools are being asked to conform to those guidelines. And so please be patient and not kill the messenger if you get a call from your school nurse or there's a rule that they're enforcing. These are not actually chosen by your school boards. Your school boards are choosing whether they are online, hybrid, or in person, but they are not actually choosing the rules regarding contact tracing and who can attend or not attend. That is a Board of Health decision. So let's talk about what those Board of Health decisions are. So if your child has one of the major criteria or two of the minor criteria, they will be told to stay home or they will be sent home from school. So what are those? Of course, fever. Fever is 100.4 or higher, and that is with or without medicine. So if you had a fever and you took some Motrin and it came down, that doesn't count. Once you've had the fever, you've had the fever. And then loss of taste or smell is a very important one. A new cough is very important as well. And congestion or runny nose, which is the one symptom that all of us are a little bit frustrated about. There are other symptoms like headache, abdominal pain, diarrhea, and those are in those criterias of two or more symptoms. And so there's lots of questions, and even for us as practitioners, like, what do we do with a kid with a runny nose? The problem is that, frankly, children can have runny nose with COVID as their only symptom. So yes, I know children can get runny noses for lots of reasons, but because COVID is so mild in children, that is sometimes their only symptom. And so that is what causing us some trouble. If your child has chronic allergies or recurrent colds, I want to circle back to our earlier videos and remind you, this is not the year to be stingy about your allergy medicines. Use your Flonase, use your Zyrtec, Singulair if you have been given that by us, and you can utilize all of your immune supplements and things, but do not send your children to school with a runny nose if you can help it, especially with the masks. The kids are like rubbing their noses and almost getting themselves to cough because they're fussing with them so much. So do your best to try to keep your child's runny nose under control, because that will be easier for you and for me and for your school nurse. If your child tends to go to the nurse often, this will be a tricky situation for you. Maybe they go down there because they're nervous, or maybe they go down there because, they like to avoid work, or maybe they go down there because they have a little bit of constipation or headaches that they get from time to time. I also want you to think about those things in two lights. One, you might want to write up a 504 if your child has, that's an educational plan for a child with a medical condition. If they have anxiety or say migraines or chronic abdominal pain or any of these things that your child frequently complains about, we should write that down for the school nurse and make a plan so that she has it in writing that, oh yeah, this is Johnny, he comes down here with a tummy ache, I give him some crackers, if it resolves, he goes back to class. She will need that in writing. Otherwise, yes, she will be sending you home, and it will be considered a COVID symptom that requires evaluation. So work with your children on how to communicate. Instead of saying to the nurse, my tummy hurts, you might want to tell your child, like, you can tell the nurse, I feel anxious and can I take a break? and maybe they could access support for their nervous time in a different way than maybe they typically have communicated that. And then you can write those 504 plans for the school as well, so that would be great. If you do get sent home from the nurse, this is the next great thing. And your child is better the next day. If they do not get tested or cleared by a physician, they cannot return to school for 10 days. So this is why I'm trying to get you to think about preparations. If they're constipated, give them their stool softeners so they poop every day and they don't get tummy aches. Do whatever you can to reduce the chance they land in that nurse's office, because if they do and they get sent home, they either need to see me and get cleared, or they need to stay home for 10 days. If they do see us, then they will have to either get tested for COVID because they have respiratory symptoms, or I will have to confirm in my chart that I have seen them for these symptoms on a more chronic basis, and that I think that they are related to that chronic issue, which will be a little bit difficult for me and my team to do sometimes. So you may end up finding yourself back to COVID testing or staying home for 10 days. We will be available. I really want to discourage families from accessing urgent cares for these kind of appointments for a couple reasons. They don't know your child, so it's going to be difficult for them to say, oh, I know this kid. Yeah, they have a runny nose every fall. Or yeah, this child's had constipation for years. They get belly pain. That's normal. So urgent cares won't be able to help you with that. The other thing is sometimes the testing at urgent cares are send out and they take 4, 5, 6 days to get back, and you will have to quarantine for the whole time that you are in waiting for your test, even if your child is better. So we utilize our testing at Children's, and we are allowed to write for those when appropriate. So if you come to us and we need to clear you to get back to school, those results come back in 24 hours, and so we will be able to send you back to school if you're COVID negative. So accessing back to us is going to be your best option if you need to be cleared to go back to school. We have other videos on here that talk more about supplemental management, and I just want to circle back to those again. C, zinc, elderberry, and innate immune response supports are our best options, and so you just want to keep those in your kids' systems, because those are your best way to stay home and be well. Of course, vitamin D is important for all respiratory illness, including COVID, and there's more and more data coming in that vitamin D is related to severity in COVID, and so make sure that we do that as well. I hope this has been helpful, and if you need us, of course, we'll be back at the office with our staff every day to help you. Thanks.